Thanks for joining us today. I'm Jessica Leino, the Executive Director of the Stanford King Center on Global Development. We're thrilled to welcome everyone today to the 2024 Pacific Conference for Development Economics. And I wanted to give a huge thanks to everyone who has helped put this event together, particularly our selection committee of faculty, postdocs, and graduate students who reviewed over 400 papers to select today's fantastic program, as well as all of the amazing King Center and SEGA staff who are here today making everything run so smoothly. So thanks to everyone for their help. And as we're gathered today to welcome our keynote speaker, we'd like to take a moment to pause and acknowledge that Stanford sits on the ancestral lands of the Muwekma Ohlone tribe, and we recognize that the Muwekma Ohlone people are dynamic members of Bay Area communities today. And by following the QR codes on this slide, you can learn about the Ohlone who live across the region and about other ancestral lands across the United States. And as I said, the King Center is delighted to welcome you and host PacDev this year. Our center is committed to helping scholars find research-based solutions to global poverty and inequality, which is why we love to host conferences like this one. And you can learn about the research we support and the opportunities we offer with this QR code as well. And now I'm very excited to welcome Rema Hanna, who is our keynote speaker, and also for the next few weeks, the Nushin Hashimi Visiting Professor at the King Center. Professor Hanna is the Jayashree Professor of Southeast Asia Studies at Harvard's Kennedy School of Government, and she's a prolific scholar. Her research revolves around improving the provision of public services in low and middle income countries, particularly for the very poor. She combines economic theory, qualitative fieldwork, extensive data collection, and cutting-edge empirical analysis to offer insights into how governments work and how they can do better. And she'll be talking with us today about her work designing social protection policies with lessons from Indonesia. Thank you for joining us, Professor Hanna.
I will start. Just thank you for having me here today. This is it's a little intimidating, so many people, but it's also very nice to be invited to give this kind of lecture. I mean, normally we come and you present one paper. Being here for this kind of lecture is really nice because it allows me to tell you a little bit about the policy context of the work that I'm interested in, the kind of questions, why I think it's important, how do I think the different papers and stuff that I've worked on kind of fit together, and what does it mean for policy. And to brainstorm on what comes next. So it's really nice to be able to share this with you and give this lecture. And so I really thank everybody for inviting me and for being here today. So today I'm going to talk about social protection in developing countries, and I'm going to focus a lot on my work in Indonesia. And so I think, for me, taking a step back, for many years, I've been very interested in this topic of social protection and targeted transfer programs and cash transfers and unemployment insurance and all these different topics. And, other than a set of researchers and some, policy wonks and, technocrats, nobody really cared about these issues so much. And then suddenly the pandemic hit, and friends of mine who are not economists, everybody was asking me about targeted cash transfers, and should we target the cash transfers in the US, and what is an automatic stabilizer in this unemployment insurance program? And suddenly it became a hot topic because the US had increased social protection spending so much. And it helped, and affected our elections and so forth. And so it was just a huge area of policy concern. But I think the thing to keep in mind was that while this was happening in the US, the same thing was being mirrored around the world in many different countries, including in some of the poor countries in the world as well, where social protection spending just increased massively during the pandemic. And in fact, so much so that the World Bank estimates that without this fiscal response across lots of countries, poverty would have just been so much higher. What's interesting to note about it is that if you look at the graph, this comes from this very nice report by the World Bank Group, kind of evaluating what happened during the pandemic in terms of social protection and taxes and poverty rates. What you see is that high-income countries spent a much larger share on social protection spending than lower and middle income countries. And you see as you get poorer down the distribution, you spend a lot less. And so at the same time, while the fiscal response was higher in the high-income countries, they also had the largest decreases or protection against poverty relative to the low-income countries. Now, the reason why I note this is it's not just that high-income countries spend a lot more, greater percentage of their GDP in sort of crisis times. This is actually true in non-crisis times, too. So even before the crisis, high-income countries spend a greater percentage of their GDP on social protection. Now, this is very funny, because policymakers are always asking me, the country is getting richer, we're growing, should we stop all the anti-poverty spending? And if history and the data say anything, that if, in fact, these programs are going to get more important as countries grow and have the ability to be able to make sure that everybody is included in the safety net and everybody is sort of protected. And so if anything, these kind of programs are getting more important as countries are growing. And so if you look at also low and middle income countries today, just over time, these kind of programs are becoming much more important. Safety nets cover, World Bank estimates, about 2.5 billion people worldwide. About 120 countries, low and middle income countries, run cash transfer programs to the poor. There are lots of challenges, though, in these programs. They're often targeted too narrowly. There's a lot of budget constraints. There's a lot of challenges in delivery. And what I think is very interesting, and I'm going to highlight, is that a lot of the kind of challenges are also present when you're trying to deliver these programs in high-income countries, but they're just so much more, so much more challenging in low and middle-income countries because of the nature of markets, the nature of institutions, and just the general information setting in these countries. And so, just to give you a sense of where I'm going, one of the biggest questions, and something that I've been obsessed with for many years, is how do you provide assistance to the right people? How do you, you have a limited amount of funds, you want to really, help people. How do you make sure it's the right people getting help? Now, in the US, what do we do? Well, if we have formal markets, there's a small fraction of people who are very vulnerable, who are not part of the safety net. Happy to talk about that later, but for the most part, most people who are employed, you're part of the formal markets. So you can verify if someone lost their job, you can verify their income level, you can even verify assets in the bank and so forth. And in fact, a lot of assistance is run through the tax system. So the Earned Income Tax Credit, big anti-poverty program, is run through the tax system. The US fiscal stimulus checks were targeted based on the tax data from the year before. Now, it's not perfect, but it means that there is a fair amount of information to figure out how can you find people who really need assistance and need assistance right now. Now, in a lot of developing countries, it's just many, many people are working in informal jobs. So there's just very limited information about people's income. How do you verify that somebody had a job separation if you can't verify in the first place that they had the job? There's limited tax systems. So for example, Indonesia is sort of moving lower middle income kind of status kind of country. It's not one of the poorest of the poor countries, but even in a country like Indonesia, I think it's only less than 15% of the people are captured by the tax net. So you don't have information through these government systems to figure out who is doing okay and who needs help. And so as a result, a lot of countries have really developed these kind of alternative mechanisms to try to figure out who to provide assistance to. Now, so you do all this work, which I'm going to be talking about today, which is how do you try to think about finding people to provide help. And then you have a second challenge where you're trying to deliver aid, and how do you make sure it gets to the people that you wanted to help in the first place. There's often a lack of transparency around these programs. There's leakages. There could be corruption. In the U.S., oftentimes you get your transfers through the bank system. But even I was reading an article in the newspaper today about how elderly people are losing their Social Security checks and bank fraud. So there's a lot of delivery challenges, even when you have these kind of sophisticated kind of banking instruments in place. But what do you do when it's more when the institutional capacity is not as high? before, just if we take a step back historically, and even in many countries today, people didn't even try to say, can we figure out who's poor? They just say, well, we'll offer these blanket subsidies. And in the hopes that, people get some stuff and that we cover people. Now, and oftentimes some of these things are like subsidies of commodities. So in some countries, they subsidize the bread. Other countries, like in Indonesia, there's been subsidies of rice, which is a major staple. In a lot of countries, it's been energy subsidies. It's a way of you go to get gas at the pump, or through the electricity system, you get cheaper energy. These have been extremely, they have pros and cons. One of the big pros is that they're extremely popular. Everybody loves a good energy subsidy, both in high and low income countries. And so they're extremely popular, and they do provide some social assistance. It trickles down. The challenge is that they're often really, really regressive. They help the rich as much or more than the poor. So for example, you subsidize gas at the pump, and who uses gas? It's the rich people who have cars. So this next thing is, it is also, especially if it's universal, for many countries, it has led to a very high fiscal strain. It's just really expensive to keep up with the energy subsidies, and then it causes all sorts of distortions. And so you can argue that you want to get, there's lots of countries where people are very energy poor and you want to increase energy, but then there might be other people in the country and you're subsidizing them to use energy, and you might not, that's not good for climate change and all these other things. And so you'd want to be thinking about these kind of issues as well. So I think, there has been a move away in the policy space from these subsidized commodities to targeted transfers. In many countries around the world. So at least 40 countries have reformed their energy subsidies since 2014, and I think this number, I don't have a newer citation, is probably a little out of date because there's been more since then. It's not linear though. Some countries have so Indonesia I'm going to talk about today, a lot of the research that I'm doing came up this policy context of how do we do targeted cash transfers when the government of Indonesia has been they were trying to cut their energy subsidy and compensate people who might have lost out with cash transfers. It's not linear though, so a lot of countries it goes back and forth, and even today, Indonesia, which I'm going to be talking about, has moved towards targeted cash transfers, but also still has as energy subsidies as well, and there's always debate about which direction do we move in. There's a quote, the second bullet point is again coming from the World Bank about, as they were evaluating the COVID crisis and sort of its impact, the different government policies on poverty, one of the key takeaways is that, even now we need to reorient away from sort of regressive, inefficient subsidies and more towards these direct transfer support systems to make sure that you're getting help to the people at the bottom of the pyramid who really need it. Okay, so then, out of all of this, so as I was talking about in Indonesia, they've gone back and forth and in terms of how they've designed their social protection system. Over the years, they've tried to reduce the energy subsidy. That could be another lecture. But they've also been moving towards targeted transfers. And so how I got interested in a lot of this research was, talking to policymakers about the questions that they had in terms of how do you design these programs in light of the challenges I was talking about before. There's been lots and lots of research done in the US welfare system. There were all these randomized experiments of US welfare programs in the 80s and stuff. There's a lot of work on unemployment, but the conditions in low and middle income countries are so different that they had a lot of questions about sort of what kind of research that is specific to the context and what does it mean as they're trying to move towards these more targeted transfer programs. And so it led me into two questions that came out of the challenges I was talking about before. One of them, and as I said, I've been obsessed with this for many years, is who is eligible to receive assistance and how do we identify them? It sounds like a simple question. It's actually, it's not so simple. And then the second question is, how do we make sure assistance actually reaches the people that you've now identified that need help? And so I'm going to be talking about a number of studies that we've done on the first question and the second question to try to think about how can we inform the policy setting. The first question, as I said, is really thinking about who is eligible to receive assistance and how do we identify them. And so, so again, a lot of this work has been done in the context of Indonesia. As I said, it's been gradually trying to move away from non-targeted subsidies on fuel, electricity, and food, although it's been a nonlinear process and kicked up again during the pandemic. But they have a lot of targeted programs. And so there is there was a targeted subsidized rice program, which I'm going to be talking about today. There's targeted scholarships for low-income kids. There's a national health insurance, and so there's subsidies for people at the bottom of the pyramid to get subsidies. There is a conditional cash transfer program. There's unconditional cash transfer programs. So there's all these different types of programs out there. And so you can see it's, lots of money is going through the system. And so you could really see why this question of are we hitting the right people is something that is very important to policymakers and really matters quite a bit. I'm going to note as well in the COVID-19 crisis, because I'll come back to this again after I talk about some of the research projects, is that there was also, it was a very challenging time for other reasons, because there's been a lot of these systems set up in place in a lot of low and middle income countries to try to identify really poor households that are very poor. It's typically done, as I'm going to talk about, on assets. So it's finding the systematic poor. And it's not done very frequently. And so then during COVID, there was also this additional challenge of, maybe these systems that we've been developing are not that flexible. Different people are being hit by the crisis. People from certain types of job industries, particularly, it's just a different type of person who is being affected. And it might not necessarily be the same as the person you have in the system. And so it really identified why having flexibility in these systems to move quickly to identify not just who is poor, but poverty is not a static concept. People who are having financial challenges when they're having it. And for me, this was really, I thought it was particularly important because a lot of my work has been trying to think about not just how do you identify who is poor today, but thinking about more flexible information systems that you could try to get people assistance when they need it and not necessarily just find people today based on their assets and then not change the list for another 6 to 8 years. So really trying to think about are there ways we can bring in softer information or other kind of information to make these systems a little bit more flexible. And so it really laid bare for me during the COVID crisis about why this was so important. Okay, so as I said before, the challenge in many emerging economies is that nobody observes any data on income, particularly for the very people you want to reach. And so a lot of these approaches that we use here, using the tax system and these kind of information networks in the US and in Europe and so forth, are just not necessarily going to work in an emerging economy. And so many countries, like Indonesia, have moved to what they call a unified database, where they do these big data collection efforts to determine people's income status. And I'm going to talk about the different tools they do use to do so. Now, it's actually kind of interesting because it leads to a lot of questions, some that are more philosophical, some that are more technical, like what kind of data should it include? Who does it include? Do you include everybody in the country? Do you include subsets of the country? What do you do if people are excluded, particularly the very people that you want to reach? How do you update the lists over time? If you go ahead and international organizations will often come in and help people set up a big database, and you get it set up right now. But then how do you make sure that that system evolves? As I said, poverty, is not a static concept, and you might want to target different types of programs to different types of people at different income levels, and so these kind of data systems can get very complex very quickly. Okay. So what is typically done in a lot of low and middle income countries is some combination of these, some of the methodologies I'm going to be talking about today. Now, oftentimes, as I'm going to talk about, these methodologies have strengths and weaknesses, and so what ends up happening in practice is that they're often combined, trying to take advantage of it, but just for the talk today, I'm going to talk about them as they're separate things and try to show some of the research we did to try to quantify the strengths and weaknesses of different types of methodologies. And I'm going to go through it a little bit quickly, just because I want to get to some of the papers. But the 3 different methodologies you see, one of them is a proxy means test. So in the US, we do a means test. You get people's income and see what their means are. So a proxy means test is basically that you proxy for income because you don't have it. And so you do these complex statistical models with household surveys to come up with some formulas, and you do data collection on the variables that go into the formula, and you predict out incomes, like an income or consumption score for everybody. Now, it has some pros. It's, for the government, it's an objective way to do it. You have hard data. You can explain it. It's consistent across the country. You could, again, people do different price levels in different areas and all sorts of other stuff, but it's something that you can see it, which, if you're a government trying to justify what you're doing is actually very important. The problem is that the income prediction is often, not, it's imperfect. I think years ago, we had spent so much time trying to improve the formulas, and you could get it to be a little bit better, but it's, at the end of the day, data collection is hard to get. There's noise in the data collection you're doing. There's noise in the prediction formula, so it's not perfect. You're going to get a lot of people who are included who shouldn't be, and a lot of people excluded who should be included. And then even though it's transparent in one way, because it has data, and it's transparent to the government, you can go to Parliament and show we calculated in this particular way. For people, it's very confusing because you have these formulas and nobody knows where they come from, and nobody knows what the formulas are. And it might be, especially given that the income prediction is imperfect, the formula would predict that my neighbor, who maybe is the same income level as me, is getting it and I'm not getting it, and then you don't understand because you don't understand the formula and nobody explains the formula. And so there's a transparency about the hard data, but there's also a non-transparency. Okay, so that's one method. The second method is a community-based targeting method. I was excited to see there's some research in community targeting in one of the next sessions. And this is where community members identify poor households. And this has pros. So the community might know better than the government about who's poor. And I could come in and I can collect some data, and I went to a village once, and we went to somebody's house to collect their data, and they had this very fancy motorcycle, and they threw a tarp over it, and they were like, no motorcycle. So whereas if I lived in that community, I would see people drive their motorcycle around all the time. So it might just be that inherently, the people around me knows who needs help, and it might not even be it might even, that's a story of corruption, but it might just be in an honest way, that the data is capturing the assets and stuff you have, but it could be that there's 2 households and they roughly have houses that look the same and they look the same, but the main income earner in that family just died. And that doesn't show up in the data, but the community knows that, and they know that that person, there's a sickness or a death or disability or something that they're going to need help, and they can predict out, they might be able to predict out who's going to need that assistance. Now, the challenge is they might not reliably or consistently report. Maybe you don't include people that are from different ethnic groups. Maybe you don't include people that you don't like. There's I actually must say, this is where for me, I was convinced the community, you'll see the results, community targeting would be a disaster because of elite capture. That's not what we found in practice. It's again how research opens your mind. But there are a lot of these concerns about the way that information aggregates up within the community. Okay, and then the third methodology is self-targeting. So this is where you go and you identify that I go and identify I need help. And in fact, the unemployment insurance program in the US is like this. You lose your job, nobody comes to find you, you go and you sign up for unemployment insurance. With the idea being that you have the best information about whether or not you need help. And so there's, again, pros and cons. A pro is that oftentimes, and as you'll see in some of the results I show, there are times when people are going to be missed by the system, and you can still go and you can apply. And then there's this other benefit that the rich could be potentially screened out by never going and applying. So you don't accidentally include people who are richer, and that saves you a bunch of money that could then be spent on like other people who need assistance. But then there's a concern that people might not know about the program if information systems are weak, that they don't have the time to apply. We often, in the theory, we talk about, well, if you're poor, you're unemployed, you're sitting around, and so you have the time to go apply for the program. But if you're rich, you're working, and you don't have the time, and that's the screening mechanism. But many of us see that a lot of the people who are in low and middle income countries who are falling in the bottom parts of the income distribution are working. I think when you look at the numbers, it's like most everybody's working. They're just not earning enough. They're very busy. They're running multiple jobs. They might get screened out because of these time factors. Or they could be intimidated. I mean, I know I had to, I don't have a driver's license, and so I was trying to change my voter registration in Massachusetts, and it was like intimidating dealing with the bureaucracy, and I have a PhD. And I work on governments. So, it's intimidating to often deal with these systems that are often very confusing, especially if there are gender issues, if you're a woman. There's a lot of reasons why you might be intimidated, and it might be differential by your income level. Okay. So, I'm going to talk about two different methods. One of them is a proxy means test versus community-based targeting. One of them is an automatic enrollment PMT versus doing some self-selection, the self-targeting method, and what the results are. And I have 25 minutes left, and I'm supposed to leave room for questions, and I'm now only starting on the papers. I'm going to go through it a little bit quickly and just give some of the key results and skip over some of the details of what we did as we go through. So the first study is a study that I did so long ago, where we're comparing community targeting versus a PMT. And again, I'm not going to go through the details, but the PMT was a data-driven approach with the statistical stuff, and then you go and collect the data from everybody, versus a community methodology where community members rank people from richest to poorest, and then the people at the bottom of both receive the program. We did a hybrid method, which I'm going to ignore for now. Now, this is where the research is interesting, because oftentimes research doesn't tell us this is better than that, but it tells us what the trade-offs are across a different methodology, and so then the policymaker can really think about this versus that, and what do I care about in terms of making a decision. Now, in this case, if you just cared about per capita consumption, the PMT method did better. There was less targeting error with the data-driven approach than the community methodology. Although it was interesting because it was not large, the difference. And if you looked at the bottom of the distribution, the community did just as well, if not better. There was a lot of disagreement around the threshold of people who, and at the threshold, there could be disagreement because there is like noise around there. So it was kind of interesting to see where the community differed. I think it was also, when you looked at the data, it's because the community was more likely to match who they thought was actually poor and not necessarily who's poor by per capita consumption. And they targeted on different characteristics than the PMT was targeting on. So for example, they loved widows. Like if you have two families with roughly the same income, but one of them is a widow, they felt like that was somebody who needed more assistance. So they were targeting in different ways. Again, it doesn't mean one is, these methodologies, one does better on one metric, the other one is, but it's doing better in a different way. And the other thing about community targeting that, again, I thought was, for me, super interesting was we didn't see a huge amount of elite capture, mostly because the elites, there weren't that many, we were looking at the relatives of the elites, and there weren't that many of them. And then they were also pretty poor too. So some of the relatives of the elites got it, but they were also pretty poor. So on that, the elite capture was not high. But actually, even though at the end of the day, it didn't look that different, the communities were much more happy when they had a voice. When they were able to contribute to the list, they felt that there were less complaints in the complaint box. There was village leaders got to decide, do they want to hand out the money in public or privately door to door, and they were much happier to do it in public when the community had participated. It was just something that everybody felt like they owned the program. And this is very important when you're doing these targeted transfers because they're very controversial, especially if you make errors and people feel like, why is my neighbor getting in and I'm not? So having a sense of satisfaction, having a sense of legitimacy and buy-in is also, is important. And it might be something that, again, as you're trading off between these methodologies on accuracy versus legitimacy and all these other issues, it's just really interesting to be thinking about. So I was actually I was telling Arun the other day, this was one of the proudest moments in my career, was that during the COVID-19 pandemic, the government of Indonesia had this challenge because there were all these people that were newly vulnerable but not included in the system. And there's also a lot of people, they know that there was exclusion error, that there were people missed by the system. And they were particularly worried that those people who had been missed by the system were very vulnerable. So they needed to figure out a way to very quickly identify people who were in need and provide assistance. And so what they did is there was this community block grant program where communities get block grants for public goods. And so money was sitting there in all these different villages across Indonesia. And they basically designed a program where they informed these local leaders that they could use community targeting, I think, to take like a fraction of the block grant and make them out in individual transfers in this particular way. So like in the first, this was, by November 2020, basically 8 million people had been received these transfers as a result of the community targeting. And actually right now we're analyzing the data because now time has gone by and we have the national sample surveys and stuff to see what happens. And you can see that the communities did it pretty progressively of like finding people who really needed help. And so it's kind of cool to see. So if I ever get invited back, I can present those results. Okay. So the second study was looking at on-demand applications and how does it compare against automatic enrollment. And so this was like a PMT, so you go out and you send the enumerators, the government surveyors, door to door to collect data on people to figure out if they're eligible, versus you advertise the program, let people know that the program exists and they could come register. They come register and you collect the data at the office. And so you do a PMT in both cases, but one of them is basically the more traditional way of going door to door and collecting everybody's data versus allowing people to apply. And then you have this like verification method through the data collection. And again, so we worked with the government was expanding the conditional cash transfer program, PKH, to new areas. And so this was actually done for we randomized which different kind of method for the actual expansion of PKH, which is a pretty large program and a large amount of money at stake. So I just mentioned that this was within a real government program, the government doing it, a large amount. It really mattered because like who gets chosen receives transfers for like the next 6 to 8 years that are pretty large. And so it actually is a lot of responsibility in terms of how you do the targeting. Okay, so we learned a few things. So first of all, the poorest households were more than twice as likely to receive PKH benefits with the self-targeting. It was super interesting. What we realized was happening, you send the government, you do these universal things where you're trying to find everybody and you send them door to door. What happens? I show up to a village, it's really hot, and I'm tired, and I go and I find some households, and a lot of households aren't home. Maybe I miss the ones on the fringes of the villages that tend to be poor. So what we were finding is that the government enumerators, even though they were supposed to find everybody, were missing a lot of poor people, particularly the poor. But when you allowed people to apply, people who needed assistance came. So they were more likely to get it, even though it was an application as opposed to what was technically supposed to be like a universal check of everybody. But what was also interesting is that when you go and you check everybody, you're checking richer households too. And as I said, these statistical formulas for the proxy means test have a lot of error. So you're including in a lot of people who are actually richer. When you ask people to apply, those people never show up, so you don't make that error. So you save money that you could then use for other people who might need assistance or within other programs. So it actually is a way of trying to reach, you ended up reaching more people who needed assistance and less people who didn't. So it was like a win-win. And it suggested a lot of flexibility, because you could do this on the PMT to do these big asset service are not very flexible, but if you have these like offices where people can enroll and get a few months of assistance and then they can enroll again if they need help, it might mean that these kind of like on-demand applications might be a lot more flexible than some of the more traditional approaches. And so we're actually, again, if you invite me back, I don't know if you would, but we're studying during the COVID-19 pandemic, the government of Indonesia used this kind of on-demand system as well to kind of fill in the gaps for to people who are like unemployed, like to try to provide some sort of unemployment assistance. And so we're evaluating that right now and trying to understand how it actually worked in the policy context. So I spent the first half of my career like very obsessed with how do you identify the right people, and I'm still, it's something that like keeps me up at night. But then I started to think, naturally this leads to a question of, we spent all this time trying to improve the targeting, trying to find people who are really needing help and are just being missed by the system, and trying to think about if we could do better in terms of reaching them. And what happens once you find them? Can you make sure that they get what they're supposed to get? And so I wanted to just quickly mention two studies that were really focused on the assistance, whether or not you can reach people. And one was about increasing transparency, and one was about changing what you give. Okay, so the first question, actually this came, so I guess now a couple administrations ago in the government of Indonesia, the president of Indonesia at the time, SBY, he cut the fuel subsidy. Anyways, it's still there, but he cut it somewhat. And so he wanted, so in preparation, as they were to cut the fuel subsidy, the idea was that they wanted to do targeted transfers in order to compensate. So for example, if you cut the fuel subsidy and it increase the transportation costs, that increases food prices, you'd want to make sure that the people who are poor are kind of buffered against that through cash transfers. And so you often see that in many countries. You cut the fuel subsidy, you give cash transfers. And so it was, but then at the same time, the government wanted to introduce, and they ended up introducing this new temporary 1-year cash transfer, but they also had other targeted assistance programs. And the vice president of Indonesia at the time, who was an economist. He was an economist at the university before he became vice president, and had a really good team. He has an amazing team in place. They were also saying, well, we have these programs, and a lot gets loss and leakage. People don't get them. So can we do something, rather than just throwing more money at the problem, which we're also going to do, but can we do something to improve those programs that people actually get what they're supposed to get? And so they came up with this idea of giving out social protection cards to let people know what they're eligible for. And the vice president was like, well, before we do this, let's figure out if it actually works. And so that's where we came in. And on one hand, you can imagine that this increased transparency helps, because now I know that I'm eligible. I can go and show my card and say, look, I'm eligible for, in this case, it was 15 kgs of rice. Before, most households who are eligible were getting at most around 5 kgs of rice. They were not getting their full amount of their full benefit. It could enable the citizens to monitor service providers, because now there's greater transparency over who should be getting these programs, going directly through citizens by mailing them cards, as opposed to going through the different layers of bureaucracy in terms of getting that information to trickle down. But there are also political economy constraints. some of the rice went missing. Nobody knows where. And it could be that it goes missing before it reaches the lower level. So the village officials are trying to do the best they can with what they have. And if people are complaining and there's nothing they can do about it, it could just cause all sorts of issues. It might not actually solve the problem and can cause like a lot of social discord. And in fact, actually in the past when they had tried to do things like this, you saw local leaders wanting to no longer be involved with these kind of programs because they felt like they had little control over them. But then people would get very upset because then there was nothing they can do to fix them. So we tried to examine this question, and we did a bunch of different things. I'm going to just talk about it. We did two things. One, we tested the card. The idea was that they were going to mail cards to households with with their name, what they were eligible for. We were a little bit worried the cards would not fully get to people, and so we also did a treatment where we publicized the cards were coming. So it was this add-on to what the government was planning to do, and this turns out to be very important. So getting a card increases for eligible families. They got a lot more subsidy, so that was great. But publicizing the beneficiary list did better than just the cards. And the reason was this. The cards are being mailed through the system, and so when they get to the local village, sometimes they weren't actually distributed. So people didn't know that the cards were coming. The local leader had them in their office. We had boxes of cards mailed back to the Jakarta. So it was, it's not just, because of the nature of the mail system, it was not just mailing the cards, but letting people know that they were coming was actually really important. And if you ask the policymakers at the time, that was what they took away from the study. And so they did a big information campaign when they mailed out the cards in practice. And in fact, when you look at the data, in our case, lots of people didn't get their cards, and those who did had better outcomes, but there were a lot of people who didn't get their cards. When you looked in the national sample surveys after they did the national scale-up, many more people got the cards than in our experiment because of the nature of the campaign that they did. And so they distributed these social protection cards to 15 million poor households across the country. At the same time, they did the fuel subsidy cuts to try to help with for people to weather the shocks that might come from the energy cuts. Okay, and then the last study, I promise. The last study is changing what you give. So in this program, as I talked about, you see people are getting a bag of rice, and there's subsidized rice. So this program has existed since when Indonesia changed from dictatorship to democracy. The subsidized rice program came into about, it hadn't changed for many years. It had a lot of problems. And in fact, actually, many people over the years were saying we should stop subsidizing rice, which there were a lot of challenges. People weren't getting their full allocations of rice. The quality was very low as you were moving it around. It was really inefficient. Rice is not necessarily the most nutritious thing to be subsidizing. There's lots of different issues with it and moving towards cash transfers. And in fact, there was very little political will to do so for a very long time. And so for many years, I have a bunch of projects on this rice project, this rice subsidy program, where we're trying to improve it in different ways. You can improve it. It still had a lot of issues. But then something happened. Over time, some of it political, some data, some things happened. And Jokowi, who's the now outgoing president of Indonesia, had the political will to transition out of the rice subsidy program into a voucher, like basically food stamps. So you get a card that you could use to at shops to buy food, and it was kind of so at the time, this, as I said, it goes from 10 kg of free rice per month to this digital voucher. And so you see that's the digital voucher, the bag of rice. And also they started experimenting that you could not only buy rice, you could also buy eggs, because they were trying to improve nutrition and stuff at the same time too. Now, this was kind of interesting what was happening, because they piloted, first they piloted in, I think it was 66 cities in Indonesia. But the idea was that it was then going to gradually move across Indonesia over time, just because it takes time to like flip a district. You have to make sure that there's enough shops with the EDC machines. So you work with the banks to do the EDC machines. You have to get people the cards. You have to just transition the system. And so they were budgeting it for a certain number of districts would like flip from over the course of, I think, about 4 years. So then we have been working with the government to try to do like experiments around the project, to do like things to try to improve the distribution and stuff. And then actually, to be honest, I got a call from a woman within the government who I worked for many years, and it's just like so totally amazing. And she, policymaker in the Ministry of Planning, and she asked if she could have a call with us, and we had a call. And she was like, you know, we're switching over the districts gradually over time. Everybody, I realize that everybody is fighting over which political districts they want to include this year. She's like, do you guys want to randomize it? Would you be able to evaluate it for us? And we're like, yeah, we'd be happy to do so. And she's like, oh, I don't know if I'm going to win. Well, she won. So 2018 to 2019 is the randomized list that she argued that they should have. And so that's the list that went out. And they transitioned. They had 105 districts that were going to be phased in from 2018 to 2019. You know, that's about a fifth of the country, all over the place. And so it really like allows us to see, you know, as you move from the in-kind transfers to the cash transfers, you can measure like GFX on price, see how the administration of these kind of programs, which is at the district level, really affects things. And so it was, you really can try to measure the impact. Now we had another challenge, so you can see from the map, you know, these are all over the country. And we're like, how are we going to like do data collection? So we worked with the Indonesian, the Census Bureau, and also the Ministry of Planning and the Ministry of Social, like, it's a multi-stakeholder effort. The Census Bureau does these national sample surveys twice a year. It has a full consumption module, and we worked with them to also add in questions. And again, it's a little unsatisfying because you have many more, you know, I would have wanted to add in like 50 million questions. We got 1 page in the National Sample Survey where we add in a set of questions about the social protection programs and whether or not you got it and what did you get. And then we also have the consumption, so we know your poverty status. We know how much you paid for rice because it's collected in the consumption module. So we have lots of things that we could actually evaluate. I'm not going to have that much time, but basically, what we find is, as a whole, much more once you transition to these like debit cards, more of the subsidy is going to targeted households. And where this is really coming about was that you are more likely to get the full amount. Like, so before I was going, and they'd be like, oh, we don't have that much rice, so you know, we only have this allotment of rice, so here, you take 5 and you take 5. And now everybody was getting their full like quota of basically 15. What's interesting is that, so more of the subsidy as a whole was going to targeted households. You did see some people who were eligible being missed and not getting the subsidy because maybe they didn't get a card or something. So one thing you do want to fix is trying to think about those, how do you improve that level of the distribution, but as a whole, that group got a lot more. And so when we looked at the poverty rates, which we're able to do because we have these like very big samples, what you find is that it doesn't, you know, you look at the country as a whole and it doesn't really affect things, but you look at people at the bottom of the distribution who are getting the subsidy, their poverty levels are going down because they're actually now getting they're getting the full quota of subsidy than versus what they were getting before. So it's interesting. So this is the government didn't change who was targeted. They didn't change the budget of the program. I mean, if anything, the administrative cost for the debit cards was a lot cheaper than the food distribution system, although actually in both cases, the administration of these programs were low relative to the amount of benefits given out, but you still save some money. So you're basically keeping the budgets the same. You're not changing who's targeted, but just changing the nature of what you give can have effects on poverty rates, and which I think is actually really powerful as governments are really constrained in terms of resources. And so this really gives you a sense of how just you could bring in evidence and stuff to try to think about, can you do better? And so this program was expanded. You can now buy, it like changed names. It became Project Sembako at some point where you could buy 7 items rather than 2, so you could increase nutrition in different ways. And it is just, and it was, again, it was one of the kind of important programs during the pandemic in terms of providing assistance for people. Okay, so I think I've run out of time. I know we're supposed to leave room for questions, but I think I left 3 minutes.
How would you characterize your process of building the trust of the Indonesian government over the many years of your research?
Okay. There's a question over here.
Yeah, I'm just curious how you think about sort of the balance between the permanence and like building in flexibility to these programs.
Yeah.
That progressivity may change over time.
Yeah.
But you also want to keep protection and structure.
Yeah, no, that's both good questions. Okay, I'll take 2 more. Question here?
On the political economy of this, given that like it's well established that handing people money is like a great vote winner, like what do you think are like the political economy like obstacles to like more switching from in-kind to vouchers or to cash transfers?
Okay, and I'll take 1 more question.
A similar question. Did you see any change in most or political beliefs after changing from in-kind to vouchers?
Yeah, okay, so let me try to answer quickly. On this one, we looked at local leaders and we didn't see switching. We also, this was before the national elections, and so we have the data there. We don't see anything, but it's also really noisy. So, despite our large samples, but the answer is probably there wasn't a big political win or backlash either way, but it is also like very noisy. Okay, so there's that. I think, there's a lot of issues. There's going to be kinds when I actually think you should do in-kind transfers. When, in this case, rice is one of the more it's like the most active market in Indonesia. For the most part, we didn't see price increases, but, as you got to really remote areas, you saw the prices starting to increase. So there are going to be challenges where, in those kind of situations and in much poor areas where you might want to do some food distribution, definitely in terms of emergencies or, so you want to be thinking about there are cases when in-kind makes sense versus cases where cash makes sense. I do think there is a lot of political issues around giving out cash that are still the same debates we have in the US about whether or not people think people are going to stop working when they get cash, even though study after study has shown that that's not the case. Whether or not people spend it on temptation goods is something I hear all the time, even though there are these many, many studies on this showing that that's not the case, and great reviews by the World Bank putting all the evidence together and showing that's not the case. But I think there's a lot of, there are a lot of these political issues around cash. I'm hoping the evidence, I think the fact that we've seen these cash transfer programs happening in many areas, the Progressa evaluation, I think did wonders for even just the movement across many of these countries. A lot of the other studies that have been done, Give Directly and all these kind of things, I really think have shifted the beliefs. But again, it's not going to be, there's going to be a diversity of views in how people interpret the evidence. And okay, so those were that. I know there was a question about building relationships, and I forgot the question here. Sorry. Oh, I think this is a good question. So for example, when you do the conditional cash transfer programs and you're looking to make investments over kids over a very long period of time, which is the point of those programs, then things like a proxy means test, which is getting at assets, might be the right thing. For others who are people moving in and out of poverty who are going to need assistance, there's a lot of newly middle class and a lot of emerging economies who need things like unemployment insurance as you lost your job and you need some help moving over or something and that's going to need a lot more flexibility. So I think you're going to need some sort of mix. I don't think and for me, I hope that's what I tried to state with the research, is not that I think one method is better than the other. I think they all have pros and cons, and the research helps us figure out what that is, and then we can use it for different things based on the context, but also the type of program or who we're trying to reach. And then the last question, I think this is a good question. For me, I've spent a lot of time, the first study that I told you about, the community targeting, we ran that with the government, but we created a program just for that targeting exercise where we gave out a little bit of money one time. And then they actually wanted to see it in a real program. And so when we did the self-targeting, the PK expansion, we actually replicated the community targeting, which I didn't present today, but within that, because it was building of trust over time. I do think, honestly, there are people who I've worked with within the government, some of my co-authors, the woman I told you about from the ministry, there's people who've worked for a long time and who are really like champions and who have taken a risk on data and evidence, because it's scary. Data and evidence can tell you maybe you're doing the wrong thing. I do think it's about building these relationships, and I think it's about finding people who are like really like very innovative and people who are very courageous about wanting to learn and trying to work together. And also, the research questions were not, oftentimes I come with my own beliefs about maybe this should be the research questions, and then we discuss and we talk together and we learn and we update and we determine these things together. We talk about the outcomes we want to measure, and it's really like a collaborative process. And I think that's, in the end, it's more relevant for the policy setting. I think it makes the research better, and it does make it realistic in terms of building it all into things that are very important. And so I don't know. I'm happy to talk more. Thank you. Thank you.
Thanks so much, Rema. That was fantastic, and I'm sure Rema will be happy to chat more on social protection over lunch. Before everyone leaves for lunch, just a couple of quick housekeeping matters. First, in line with Stanford's zero waste goal, everything in the lunch today, from the cutlery to the boxes, is compostable, so please make sure everything goes in the compost bin. Also, if you want to sit outside but it's too chilly, there's blankets at the at the help desk, so please feel free to help yourself to them. And finally, I've been asked to announce that PacDev 2025 will be hosted by USC and UCLA. So see you in Southern California next year, and in the meantime, enjoy the afternoon sessions today. Thank you.